welcome to the Stronger After Stroke podcast. In this episode, we're going to get to speak with a speech-language pathologist. That is a big long term for speech therapist, which you may have heard of before. This is Anne Blandford. Hello. Thank you so much for being with us today.
Thank you for having me. I really appreciate it.
And speech therapists are so important to the care of someone who has had a stroke in lots of different ways. So I would really like to make sure we define kind of your role in that area. First of all, what is something you wish everybody in the community knew about speech therapy?
I wish that people knew how much we can do to help individuals who have survived stroke, to help them speak, think, swallow, eat, and just live their best life after stroke and get them hopefully back to the best them that they can be.
What do you hear most people think a speech therapist is for?
Well, I think the biggest thing that we get is that we help people say R.
The letter R?
Yes, the letter R, because most people in my profession work with school-age children. But in the adult world, we do so much more than just the clarity of speech. We work on how we can think through our thoughts, explain things, remember things. We work on the clarity of speech. The clarity of voice, how we can coordinate breathing, and also eating. That's a big part with stroke as well.
And I think that's what most nurses would associate with speech therapy because would you say most nurses would assume you're going to assess a patient's ability to swallow?
Yes, that is a very researched, standardized part of patient care is to make sure that patients are not what we call aspirating or having food go down the wrong way. And I feel like a lot of people know that about stroke care, but sometimes what we don't know that speech language pathologists do is really work on how we think through things and then communicate after stroke.
Yeah, and that is something that I have learned more about as I've talked to people along their stroke journey in the days, months, and years after it takes place. When I worked in the ICU, I would consult speech therapy to come assess the swallow, like you said. And so that was our first introduction on my end.
Mm-hmm.
And then I would stay with my patients sometimes and help with them doing the cognitive assessment, like you were saying. And that's when I really started building more of an appreciation for the wide spectrum of things that speech language pathologists can address. So thank you so much for taking the time to introduce that concept to us. And what would you say is one of the most frequent questions you get from patients when they first come to see you?
Why am I here? I do get that because typically people say, I speak well. However, when I get into really knowing the person, I get the thoughts of how am I going to get back to who I was? I have a hard time concentrating. I can't really think through what I'm doing. People look at me and they say, you're doing so great, but I don't feel like I'm doing great inside. And so that's really an important part of their journey and assessing them and finding the best way to help them.
So I guess you probably get a lot of timeline questions too, right?
Yeah, especially when am I going to be normal again? And that's a hard question to answer. And what we know about the brain is that at least 8 weeks to make brain changes for what we call neuroplasticity changes. And that's new pathways in the brain to help us think in a way that we did before, but maybe now has been damaged by stroke. So we usually say if you're going to come to therapy, we want to give it at least 8 weeks to help that brain make those changes.
Not saying you have 8 weeks after your stroke to make those changes, but saying from the time you start doing the exercises, for lack of a better term,
Yes.
That's the time period you can expect to start seeing results.
Yeah, people want to see results immediately. And so we really frame it that we need at least 8 weeks to make those neuroplastic changes. Recovery from stroke can take longer than that, but people sometimes want to say, oh, I'm not getting better, so maybe I should stop. When really we say, listen, this is kind of a marathon, it's not a sprint. So give your brain time to make the changes that we really need to make.
Yeah, definitely. It is a marathon, not a microwave situation.
Yes, yes, for sure.
So, what are some things that people can do at home to help with getting their cognition better, or even some speech exercises that they can do at home, maybe? Because a lot of our listeners for the Stronger After Stroke podcast live in rural areas or
Mhm.
in countries or outlying areas that don't have specialized services like
Yeah.
you can give our patients here in Louisville in person. So, what are some things that you think people can take home and do that can help them get better?
Sure. So, the number one thing that I tell people to do when we're working on getting our communication back, whether that's through just thinking or the clarity of our speech or getting the words out, is to try. And so, oftentimes we don't want to say something when we don't 100% know the answer, or we don't know if the right thing's going to come out. And so we have to work through that. If you don't use it, that you will lose it. And so we need to use it. And so working with your family, any caregivers, or by yourself to just name things around the room and work till you get the right thing out. When we're talking about cognition, anything that you can do to think through the steps of stuff. We do things automatically, but if we can talk through our steps of making a meal or what we do for laundry, make checklists and then read through them and talk through them. Those are really important things to activate that language and cognitive portion of your brain. That's really important. If you have a caregiver, one thing that's really important is for that caregiver to give you time to answer. Oftentimes, our caregivers love us so much that they want to help really fast so as to save maybe some embarrassment or feeling bad about oneself. But it's really important that you try to do the communication and that caregivers pause and really give a moment for them to get the thoughts out. It empowers the individual, the survivor of a stroke.
That is so important. I know that was hard for me to learn as a nurse because in the hospital, everything's kind of fast paced and we have so many assessments we have to do. And so it was challenging for me to learn. But thankfully, our speech therapist was so helpful in teaching me that we people are capable of doing so much more if you allow extra time for them to do it, especially after a stroke, because there just might be a delay
Right.
and they need time to let those words make it from their brain out their mouth
Yeah,
sometimes.
it's so true. And most of the time, it's not bad intentions that people speak for you or speak over you. And so I talk a lot with patients and caregivers about like this is all from love and it's from people who care about you. But sometimes it feels like for the patient that their independence is being taken away too. So it empowers that patient not only to improve, but to be able to be in control of one's own recovery.
Definitely. And something we have spoken about on the stroke podcast before, what are aphasia support groups that are available virtually. I think they're all free on
Yeah.
virtualconnections.org. I think is the name of it. And you can have those opportunities to speak with other people who have aphasia and understand your need for extra time to finish your thought. There's also another episode we did with our music therapist. You may know about how she works with patients to sing their way back to talking.
Absolutely. There is a type of therapy within speech therapy that we use music and intonation because it does help us get our words out. And sometimes even people who they may not have aphasia and the words come easily, our thoughts just lag behind too. And so rate and rhythm can help feel more comfortable and get those thoughts out as well.
That is so amazing. And yeah, your assessment is so thorough at defining where one ends and the other begins because it can be
Yeah.
really hard to tell because everything is so interconnected.
Yeah.
So I want to thank you for putting this together before we got together today and took the time to put together a tip sheet. And we will have a link to this PDF in the show notes. So if you're listening on Spotify or Apple Podcasts, or if you're watching on YouTube, look in the show notes and you can download this PDF and print it out. It has home activities that you can do with your family or independently. Do you want to talk about any of it right now?
Sure. Sure. Yeah. So with thinking and remembering, we call those cognitive processes, but really it relies on paying attention, organizing your thoughts, and thinking through things clearly and being able to remember. So the show notes that you'll have talk about different household activities that you can do to really organize your thoughts and help keep your attention. So checklists are really important. Keeping a visual calendar so that you can organize your day and get yourself into routines, because routines are really important in recovery. There's different games you can play that help make sure that you get some good language and cognitive stimulation. Some people like Scrabble, some people don't. That's a good game to play, but even a solitaire, Go Fish is a simple game to play that requires you to speak. And so people don't think about that, but that's a game where you're required to speak and take turns. And so you have to understand what the other person is saying and also express what you want. Um, and those are some different types of games. We also encourage journaling, uh, doing any kind of laundry, cooking may have to be supervised, but talking through the steps, talking through what you're going to add to that recipe, how long are you going to cook it? Those are different types of things that really help you think through things clearly and also express yourself.
Yeah, and as far as the games, that's a great way to connect with like the children in your life and things
Hmm.
like that. And I would think, is there some kind of connection between the kinetic movement of doing things like folding laundry and helping
Yeah.
with your cognitive
There really
processes?
is. So that motor movement really helps us use a different part of our brain to remember and process information. And so anytime we can add a motor movement to an activity while we're using language or having to remember something, actually stimulates even more parts of the brain. And so games and talking through doing the motor task of laundry, all of those are getting whole brain exercise, and so it's really important in that recovery process. The other thing about all of these is that the good thing for cognitive brain health and recovery is that we do need socialization, we need physical activity, and we need cognitive stimulation. And so doing a game with somebody provides all three. You're physically moving, you're socializing, and you're getting that cognitive and language stimulation.
That is just so wonderful. I love how it just is a whole complete picture there. We also here at the Resource Center for the Norton Neuroscience Institute offer brain games as a group activity. So if you don't have people in your life to play these games with, you could always join in on things like that with the community to
Mhm.
get that practice. It doesn't
Yeah.
have to be with your family.
No, and there's if depending on your age, there's senior centers in different
Mhm.
communities, churches usually have some sort of group, and so trying to find those resources in your community.
We even have a neuro choir. I
Yeah.
have to brag on my music therapist again, Carrie Willis. So if you want to go back and listen to her episode, be my guest. So I think something you and I talked about when we were preparing for this episode, you mentioned it, but I want to go back to it, is focusing on their breath.
Mhm.
So, how can focusing on their breath help with learning their cognition or
Yeah.
relearning their cognitive skills?
Sure. So, a couple of things. First of all, when we start to have cognitive discomfort or deficit, we start to get anxious and we start to press ourselves to get words out, to get our thoughts out, and we start to get tense. And so, really, we use mindfulness and deep breathing to help relax our bodies and our minds to be able to find the freedom to get our thoughts out. And so, it's a good regulator. It also is a good restart when we're stuck, to do good deep breathing in through our nose and out through our mouth, and concentrate on that for a minute before you go back into the task you're doing. It will decrease your frustration. It will help your brain organize the thoughts better and be able to get the information out.
And I mean, one of the main problems with having a stroke is your brain lacks oxygen
That's true too.
due to
Yeah.
the lack of circulation. So we need all oxygen we can get
Yes, we do.
for our brains to work,
Yeah.
right?
People
Yep.
tend to hold their breath when they're doing activities, right?
Hmm.
And the number one thing that anybody in exercise science will tell you is you have to expel and breathe in when you're exercising. It's the same thing when you're doing a cognitive task. When we're doing something that's hard, we want to hold our breath, but we need that oxygen and blood flow to make our brain work our best.
And it sounds like such a simple thing because we oftentimes don't need to think about breathing in
Right.
order to survive. But I mean, even in this conversation, like if we're in the middle of a certain topic and I'm trying to make sure I'm ready,
Mhm.
I'll forget to breathe. So, so I was being more mindful as you were talking about it to make sure I'm taking deep breaths as well. So, um, it may feel silly the first time you try to be intentional about your breathing, especially if you're not used to doing the in through your nose and out through your
Yeah.
mouth. But it definitely makes a huge difference, and your brain will feel it very quickly. So
Yeah.
that's one of those microwave solutions,
Yeah.
actually, because we were talking about how it takes so long to see progress,
Right.
but oxygen can go a long way really fast.
Yeah.
So, before we conclude, would you care to go over the differences between expressive and receptive and global aphasia, since
Sure.
you're an expert in this area?
Yeah. So sometimes individuals who have stroke will have what we call aphasia, which is a disorder of language. There are several types of aphasia. We can classify them into maybe three major categories. So the first is going to be an expressive aphasia. And that expressive aphasia is when the individual understands everything you're saying to them, but they can't get their words out. It may be a mistiming, the words don't come, it may get jumbled up and the wrong word comes out. That would be our expressive aphasia. On the contrary, a receptive aphasia is when the individual can't understand the language coming in. So they may talk like we're talking right now in a normal cadence and prosody, but the words really don't make sense because they don't have the input to know that they're saying the wrong words.
It's kind of like talking to somebody who can't hear.
Yeah. Yeah, it is. And the other thing is that when you say something to someone, they hear incorrect words. And so the person who has had the stroke or has aphasia might do the wrong thing, and it's not purposeful. That's what their brain is hearing when in actuality it's not what was really said.
I think I had one patient who actually asked if there was something wrong with us when we were
Yeah.
trying to talk to them and they could very clearly say,
Yeah.
I think you need to learn how to talk or something like that
Yes.
because they were able to say what they were thinking, but what we were saying was not making any sense.
Exactly. They usually don't have that awareness that they're not understanding.
Mhm.
It's very difficult, and that's based on where it happens in the brain.
Yeah.
And then we can have global aphasia, which really is a major stroke, and those are individuals who have difficulty understanding and expressing language. And so they have very minimal output. And with those individuals, we like to use as much visual um, communication as possible, pictures, gestures, anything that takes kind of verbal language out of it. So we want to take our words out of it. When an individual has aphasia, reading and writing is also impaired, just like their expression, their mouth expression is. And so with people with global aphasia, and sometimes even receptive aphasia, we want to maximize gestures, pictures, any kind of visual communication.
Yeah. And like you're saying with writing, sometimes it may be involved and sometimes that may be something that they still are able to do.
Mhm.
So for some people who are not able to speak, they are able to write to communicate
Sometimes,
sometimes.
sometimes. So typically our written language mirrors our expressive
Mm,
language. So if somebody has an expressive aphasia, giving them a pen and paper to write out their thoughts are going to be just as difficult as speaking. But sometimes they can do a yes, no, they can write the initial letter. So that will really help because that enables them to communicate with the person across the table or the person next to them on the
mhm.
couch, um, that the other person can understand what they're saying and kind of get their own codes as they get through therapy or, recovery.
That is so fantastic. So as you can tell, speech therapy is a big like there are so many options of things that you can
Mhm.
pull from in your treasure chest of ways to help people
Yeah.
with so many different kinds of issues, if it's speaking, if it's thinking. And so thank you so much for taking the time to explain that, because I think a lot of people, like you said, are like, why am I here? Why did my doctor say I need to go see a speech therapist? um, may not know till you get there,
Yeah.
but you guys are very well equipped to find out a
Thank
way
you.
you can help people. So thank you, Anne.
Thank
And
you.
yeah, was there anything I didn't ask you about that you want to make sure we cover?
Um, I don't think so.
Okay, well, that's great.
I think you got it all.
Okay, good. Well, thank you so much for listening to this episode of the Stronger After Stroke podcast. Subscribe on your favorite place to listen, whether that's YouTube or Apple Podcasts or Spotify, so you'll be notified when the next episode comes out next month. And please leave in the comments if you have any suggestions of topics you'd like to learn more about or any feedback of what you found helpful. And I'll see you in the next episode.